this is a Saturday before a long weekend. I think everybody's excited about the long weekend, plus Hari Raya tomorrow. So in any case, we're just going to go through this planned webinar. So today's talk is going to be about vaginal laxity. Okay, in Malay, it's kekenduran faraj. This is a very common problem. Ramai orang tanya saya berkenaan dengan keadaan ini, dan dulu memang tak ada apa-apa treatment yang boleh dibuat. So let's go through it and understand what it is. Okay. So this is the female reproductive system, where it is made up of, as you all know or don't, it's got the ovaries, it's got the fallopian tube, and then we have our uterus with the cervix here, and this is the vagina. Okay, this is our reproductive system. Okay, now what happens in vaginal laxity? So in vaginal laxity, this is referred to as a looseness. Most people say loose vagina, or dalam bahasa Melayu kita cakap, kita kata rasa longgar, yeah. And so many women actually find this happens after the vaginal childbirth. Usually it's after a vaginal childbirth, but it is also associated with aging and menopause. It is not just in women in the after childbirth, and so women who's not had vaginal childbirth can also have some amount of vaginal laxity. 2 out of 6 women in the world actually have vaginal laxity, and because of this, they feel less sensation in their vagina, especially during intercourse. So this is again the female reproductive system from the side. Just to remind we all what it is. Basically, this is the uterus and the cervix and our vagina. It is in between 2 very important organs. One is the rectum, where the anus is, and the other is the bladder with the urethra or the urinary outlet. So in a woman, there are usually 3 holes, yeah, the anus, the vagina, and the urethra. Okay, so this is very important because in vaginal laxity, something happens around here. In between these tissues, there's this muscle, which is called the pubococcygeal muscle, and this muscle, or we call it the pelvic floor muscle, is a very important muscle. Okay, so again, vaginal laxity is the looseness that occurs in the vagina. Many women find it happens after childbirth. It is also known as vaginal relaxation syndrome. Because of this relaxed condition, there is also some decrease in sexual satisfaction, and there are some women who complain that they are unable to experience orgasm anymore due to sensation. And so what happens is the vagina from this becomes this. It just becomes bigger, so loose. So the vagina, as we know, do change over time. It is a living structure, so it will change over time. It doesn't stay stagnant. And the elasticity changes due to age as well as childbirth. There's a myth going around that if you don't have enough sex or you have too much sex, the vagina will become loose. Some people come to me and say, you know, I have too much sex, I have every night, so will that make my vagina loose? Actually, it doesn't. It's just over time, age and childbirth makes it slightly loose. Okay, so how does that happen? As you can see, the baby presses upon, in our uterus, presses upon the cervix, right? And then causes stress to the vagina outlet. So as when we give birth, as the baby descends into the birth canal, the vagina, there is pressure, and as the baby comes out, it actually expands the vagina wall. All right, and so no matter what happens, the vagina actually becomes bigger and loose, and although it contracts back to normal, to pre-pregnant or pre-pregnant state.
Tak boleh nak share screen tu, I put
How do
as a post. So I tak boleh control kat sini.
How do I know that I have
I tak boleh nampak kena ada masuk anak invite.
Sorry. How do I know? How do I know you have I have VRS, or how do you know you have VRS? One of the symptoms that you may ask yourself: does your vagina feel loose, especially when you're having intercourse? Does the penis feel like it does not have a tight grip? And a lot of women, if it's due to childbirth and if they are an sexually active person, you would actually know the difference between what was before and what is now. Does it feel like there's no friction with intercourse? And this is the reason why sometimes intercourse or sexual relations doesn't feel as satisfying as before. And do you find you have lost less sensation with intercourse since the childbirth? Okay, so these symptoms are apparent, and this is what we call the vaginal relaxation syndrome. Okay, so again, what is the vaginal relaxation syndrome, or VRS? This is the term that we use for vaginal laxity as one of it. The number one cause is, of course, vaginal childbirth, right? And many women, particularly their partners, are very concerned about this, if the vagina would return to following the
Yes. Nutrition, nutrition, we almost can.
The fact is that it doesn't go back to normal, even though it may go back to almost what it was, but it will never ever be the size of pre-childbirth. Okay, no matter what the head, as you saw just now, as the head descends, there is some tearing of the vagina during this delivery. It can heal completely and the muscles will re-strengthen, but the vagina will forever be larger. Yeah, walaupun selepas beranak ya, vagina tu faraj kita akan kembali ke hampir seperti sebelum bersalin, tapi dia tidak selama-lamanya akan lebih besar daripada saiz yang original. Yeah. So apart from in VRS, there are other problems that occur when there's vaginal laxity, apart from just feeling loose, sexually insensitive. But 1/4 of adult women will also have pelvic floor disorder. Pelvic floor disorder is like the picture I show you, all the different organs over there will also have a problem. One of the more important ones is called uterine prolapse. Now let me just show you what happens in prolapse. This is normal. Okay, again, the rectum, the uterus and vagina, the bladder. And what happens is when the muscles here are loose, you can have the prolapse of the bladder, where the bladder actually comes out and drops, and we call this the anterior prolapse. We can have the rectum also coming down. This is called prolapse of the rectum, or a posterior prolapse. And the last one, we can also have the whole uterus coming down. This is called prolapse of the uterus, or a vaginal prolapse. Okay, this is actually the most common prolapse condition. Again, prolapse of the bladder coming down, we call it a cystocele. The uterus coming down is a uterine prolapse. And if the whole structure comes down, it's a vault prolapse. Okay, so when this happens, not just the vaginal relaxation syndrome, it causes a whole relaxation of the whole structure in that area. And we get you get pelvic relaxation syndrome, which results in laxities of the ligaments and the fascia and the muscles supporting the pelvic organs. And about 9% of women actually need to undergo surgical repair for this. Okay, now what contributes this? Who would progress from a vaginal relaxation syndrome, just vaginal laxity? Some people progress on to pelvic relaxation syndrome or to a prolapse condition. And who are these people who would go on? Who would be more at risk of getting pelvic prolapse? These are, of course, multiple childbirth, people who deliver many times, obesity, aging itself, injury where you have to stay in bed and lie in bed a lot, and especially in pelvic surgery, and of course chronic straining. Just like in men, sometimes you can have inguinal hernia if they strain too much while they're pee. So for women, if there's too much straining, like lifting heavy objects and all that, you can actually have prolapse. Okay, so anything that increases the abdominal pressure, like lifting heavy things, of course, any tumors, any medical problems that can increase the pressure inside can actually give rise to, can worsen the pelvic relaxation syndrome. Okay, again, a picture of how the normal anatomy is, and then this is the prolapse condition. You see, this is anterior wall prolapse where the bladder comes down, and of course, in this case, you will get urinary incontinence. This is a diagram of how a cystocele or a bladder prolapse look like. Comes out like this, that's why it's called a cystocele. And now we go through uterine prolapse, because this is the one that most commonly found and most women have. So a uterine prolapse is when the uterus descends. In Malay, we call it jatuh rahim. Okay, the Makcik Urut is always very concerned about this jatuh rahim thing. So it's actually uterine prolapse, whereby the uterus actually descends down towards the vagina. And this happens when the pelvic floor muscles and ligaments become weak, like I told you, in the contributing factors, and it's not able to support the uterus anymore. Okay, so where you can see the uterus at the vaginal opening. I'm sorry, this picture is not very clear, but this is how it goes. Okay, this is the uterus. It should be up here, but instead it's down here. Okay, see the uterus? It descends down the vagina. Okay, because there's no muscles holding the vagina. So when the vaginal wall is lax and weak, then the uterus can easily just fall out. The important muscle is this one. This is the muscle that holds the outlet of the vagina. So what causes it? Actually, is we don't know how common it is, because many women who suffer from it don't really come forward. I think women in the urban community, wanita di bandar, yeah, where they have easy access to their gynae, they go for checks, they do their pap smear. This is when the early prolapse can be detected. Unless they have severe problem, they may not seek professional help. They may not come to us, right? But some of them would show things like those symptoms, like I said, they feel something inside, they feel something coming out, or they have a urinary problem, then they may seek help. But otherwise, we don't really know how common prolapse is. Although some studies have shown that there's about almost 40% of women has some degree of uterine prolapse. Okay, and of course, it's more common in the baby boomers. So this is just a diagram to show the progression. We stage the prolapse into 4 stages so that we can know the degree and what sort of treatment to do, what sort of procedure that can be undergone. So stage 0 is where there's no prolapse at all. Stage 1 is just the end part of the uterus, which is the cervix, is at the proximal level of the hymen. Meaning you can just see it from outside. It's not protruding yet. Stage 2 is that some of that uterus, which is the cervix, is already coming out, but less than 1 cm of the uterus is coming outside. The stage 3 is about 2 cm is seen outside, whereas in stage 4, almost all of the vagina is outside. You can see the vaginal wall. Okay. This is another diagram. You can see the descent, uterus coming down. This is normal. In the first degree, you can see if I were to put my finger in, I can feel the opening of the uterus or the cervix. Second degree, you can see the opening at the mouth of the vagina, which is the hymen. Third degree is when it's out, and almost all of the vaginal wall, this is the vaginal wall, is out, is stage 4. Okay. So this is a visual picture of what actually happens. This is stage 2, where the little bit, about 1 cm, less than 1 cm of the cervix is outside of the vagina, right, of the introitus. Stage 3 is more than 2 cm is out, and stage 4 is almost the whole of the cervix with the vaginal wall is out. Okay, this is just the posterior wall. It's considered stage, not even stage 1, but the posterior wall is weak already. Okay, you can actually feel it if you were to put your finger in. You can feel that it's jutting out. So if your posterior wall prolapse, means the posterior is the back wall of the vagina that has actually weakened. Remember the muscles I showed you here? Those muscles have weakened. So now the rectum then gets pushed forward, and you can see the back wall coming out. Okay, what does it feel like? Feeling of fullness, pressure in your pelvis. Some people even have a bit of a low back pain. You feel like there's something coming out of your vagina, and you may even notice a bulge at the opening of the vagina. Now this bulge isn't dangerous, but it is very uncomfortable. And if the prolapse goes way down and it is the bladder, then that will bend the ureter, and you're going to have trouble urinating. You're going to have urinary incontinence. Okay, what happens if you do not treat it? Of course, it's going to get worse because gravity continues to put it down. Aging continues, and the muscles get weaker, and so slowly it's going to get worse. In some cases, it may even cause obstruction of the kidneys and urinary retention, and thus you can get damage or infection. So this is what may happen also if it's protruding out. You don't do anything, it rubs against the surface of other things, and you can actually get a cut and excoriation and abrasion, and well, it's just injured. Okay. So treatments of VRS, vaginal relaxation syndrome, there are many now treatments available. If it's just laxity, there's laser treatments where heat is applied onto the tissues to stimulate the collagen and get a taut vagina. We have gone on to do even vaginal fillers. I put in fillers in this area to create a thickening of the wall so that it's thickened and it feels more taut. There's also threads. We can put threads to tighten the vaginal wall and lift the tissue so that it has a tightening effect. Of course, at home, you can do pelvic floor exercises where it strengthens the muscles around the pelvic area. And we can have creams and serums that you can apply inside that can help with, just rejuvenating the vaginal wall. Okay. Non-surgical, there are things like pessary that for prolapse that doctors will put in to hold up the uterus that's coming down. Kegel exercises is the exercise where you strengthen the pelvic muscle. This is just a picture of a pessary. There are 2 types, the ring and the non-ring. This is inserted to help hold it up like this. Okay. Pelvic floor exercises is, it is basically squeezing the muscles around the vagina area. It is located between the anus. I showed you in the anatomy picture just now, and that helps a little bit. Okay, it does help to tighten. Okay, because it holds the vagina with the external, the distal end where the exit part of the vagina, it holds it like a sock. Okay. So what other solutions do you have apart from surgery? Now, those days that was it, and if it gets worse, you go for surgery. But now there was an unmet need. There's a need for some treatments that's more effective, more definite for people who were a little bit symptomatic, may not need surgery yet. So instead of suffering, can they do something? Can we do something to make it better, to reverse a little bit, to strengthen the vaginal wall so that you don't feel so, so that you can bring it back a little bit, and so the condition doesn't worsen and then you need surgery. Yeah, so that was when in 2012, the first laser came out, and since then there's been a few lasers as well as radiofrequency that has come out and has received FDA approval to help with this condition. So the latest advancement for vaginal laxity between non-surgical home remedies and surgery is actually the vaginal lasers. It started with the ablative CO2 lasers, and then later on it went on to the radio frequency devices. Okay. How does this treatment cause vaginal tightening? Because the vaginal wall is composed of collagen fibers of triple helix, okay, and these are protein. So when they are heated up, they are like, you know, I always say collagen fibers are like as protein, and they are like egg protein. So for egg protein, egg white to harden, you need to boil it in hot boiling water for a certain duration for it to become hardened, yeah, become hardened egg white. So same thing like the collagen fibers, it needs to be heated to a specific temperature. And once this temperature is hit, the links between the complex structure breaks down, and then the collagen contracts. This contraction of the triple helix then makes it thicker and shorten the collagen fibers. So by thickening and shortening, it becomes thicker. Okay, and this is the immediate tissue tightening effect that you feel after a laser or radio frequency treatment. Okay, whatever partially broken collagen. Now, as we age, part of the collagen has broken down. They're partially broken and probably going into dormancy. So what happens is these are the ones that will react to the heat better, and by tightening, it will then also send signal to the other present collagen, and new collagen will be produced. So this ability to create new elastic tissue makes this thermal means heat producing devices very effective for vaginal laxity. Okay, so what is vaginal rejuvenation? Is a broad term that we use for vaginal corrective treatments. It could be non-surgical, it could be surgical. It is used to be done for cosmetic reasons, but now it's more to solve age-related problems or conditions that we may have, such as vaginal tightness or urinary incontinence. Okay, they are energy-based. So what are they? What do we have? It's going to improve the health and the vitality of the vaginal walls and the muscles around it. And it is very popular now because it is, for those in stage 1, they may not need anything, but they can do it to prevent it getting worse. But those in stage 2 and 3 who do not need surgery will find that this is very effective. Also for those with just usual basic vaginal relaxation, vaginal laxity. Okay, so let's look at some of the procedures. Laser. There are 2 types of laser available for the vaginal area. It's called a CO2, carbon dioxide laser. In this case, we call it the Mona Lisa touch, and the erbium yak lasers. The CO2 laser are fractional lasers, and what happens is once it's inserted into the vagina, it creates multiple columns of burn marks that then heals and causes the vaginal wall to tighten. Whereas the CO2 can penetrate a lot deeper, so it's much better for tightening, but it has a slightly higher risk. Whereas the erbium yak lasers can also, is more towards the lining of the vaginal wall where the collagen is. So both actually works very well, just one goes deeper, one is more superficial, but one stimulates more collagen, whereas the other can reach the, almost reach the muscles. Okay, it involves a vaginal probe that we put into the, I'll show you a picture later, and the laser beams are then emitted. Okay, one of them that is very popular and famous, and we carry that in our clinic, is called the Intima laser, which is is an erbium yak laser, which is specially used for laser vaginal tightening. Okay, so the probe is entered into the vagina like this, and then the laser is shot, so it's quite comfortable. You feel some heat generated, and it goes all round 360 degrees. Okay, so here's another vision. So lax vagina goes in, the laser is shot here, few passes, and so you get thickening of the walls, and with thickening of the walls, there is the vagina gap, the lumen is smaller, and there is contraction of collagen, so it goes inwards and you can feel the tightness. Okay, simple as I can show you here before treatment, how the wall has thinned, and then after, and how it has thickened. Okay, before and then after. So that gives a feeling of fullness and tighten and strengthening of the vagina wall. Okay, same here. This is vaginal relaxation syndrome where the vagina is all relaxed and loose. After the intimalis treatment, the canal is smaller and tightened. And so you see, when it's tightened, the ureter and the bladder rest better. So there's less risk of getting incontinence and also prolapse of pelvic tissues, pelvic organs. Yeah. These are results that was shown with intimalis treatment, whereby the patients were assessed for sexual gratification after the intimalis treatment, and only 5% said there was no improvement. More than 50% had better orgasm, because when the relaxation, the laxity is improved, then sensation is also improved. Because you know the whole vagina wall contains blood vessels and nerve endings, right? So sensitivity and enjoyment of sexual intercourse is actually dependent on the good circulation and the good amount of nerve endings, right? Activity. So better sensation was felt in 95%, almost 100%. So this is very good. Okay. Now, what is radio frequency? How is radio? Later, after the lasers came out, the radio frequencies came out. Concept is the same. Basically, it hits up the vaginal mucosa up to the target temperature of 40-45 degrees. So it's very simple. We know that the skin is made of collagen. So what the scientists really found out, that you know, if radio frequency can hit the skin and cause tightening of the facial skin and everywhere else in the body, the vagina wall is also made out of collagen tissues, fibers. So why can't radio frequency also heat it up and also make it thicker and tighter? So that came about a radio frequency treatment. Okay, with so the heating goes up to 45 degrees, and in the lab it has been shown that for collagen to contract, it needs about 56 to 60 degrees for it to contract. And for triple helix, it can go up to 45 degrees. Okay, so the 45 degrees heat produces an immediate superficial tissue shrinkage. Immediately it contracts. Okay, plus radio frequency can go deeper and into the deeper collagen layer. And specifically, the radio frequency device that is world famous, there's only one available in the world right now. It's called VIV. It's the only one that's approved by FDA, and it is a radio frequency device. It is called VIV or Genevieve, and it's specifically for the treatment of vaginal laxity. Until recently, it was also used, it is now available for urinary incontinence. Definitely improves vaginal lubrication. Improves vaginal lubrication because once the vaginal walls are healthier, tighter, thicker, then lubrication is also better. And this will then tighten the labial tissue. It will also look nicer on the outside. Okay, this is how the device looks like. This is the VIV vaginal system. It is a single-use tip, so only one treatment is required, is necessary, and it's discarded after. It's inserted into the vagina, especially at the external 1/3, because this is where the muscles are, and then the tissues are heated to deliver the heat. Monopolar radio frequency goes right into where the collagen fibers are to form new collagen. So this is one diagram to show how it heats. There is a cryogen spray when the treatment is being done. The cryogen spray is cooling, so the tissue is heated, hot, goes in deep to 5 millimeter, almost 6 millimeter, and then the cryogen is expressed out to cool the surface. So it doesn't burn the surface of the skin while pushing the heat deeper in, because this is where you want the heating to occur, where the collagen to be regenerated. Okay, so there is a reverse gradient. There's cold and hot inside. This reverse gradient has been scientifically shown to push heat further and cause significant heating. It penetrates 3 to 5 millimeter, and this is done all around the vaginal wall. Okay, and we do it overlapping so that the energy then enhances and continue to prolong the thermal effect. It's able to heat up to 54 degrees. Remember I told you for collagen to contract, it needs about 56 to 60 degrees. So this device is able to generate this amount of collagen without injuring the surface of the vaginal wall, right? So in one session, this is also to show how deep it goes in. It goes one laser, erbium laser goes this deep, okay, superficial layer. CO2 laser goes slightly deeper. Topical RF is another type of RF, like Thermi RF goes here, but VVIV can go right up to here. Definitely goes much deeper, right up to 3 to 5 millimeter, almost up to where the muscles are. It's only a one session treatment, and that's the only non-invasive single session treatment for vaginal laxity using this radio frequency for tightening of the vaginal tissue. Okay, I can show you, this is an example of a picture of what the vaginal tissue looks like at day 10, cross-section biopsy, day 10, where the fibers are very far apart. There's a lot of space in between. And at day 90, how dense the collagen, if I look at the collagen, it becomes more dense and compact, almost like a, okay, almost like a young vaginal wall. That's that. And in this study that they showed, this is the tightness. There is a device that we use to check for the tightness of the vagina, and you can see, so here it shows like a prior to delivery, the level is 5.3. After delivery, this is baseline. Most women with laxity is at 2.6, and what happens after the treatment? Month 1, there's some improvement. Month 2, more improvement. Month 3, maximum improvement. At month 6, almost close to what it was before delivery. See how great, how amazing this is. The tightness is almost near to before delivery. Of course, we continue to age, and of course, time passes, and collagen will continue to die and drop off. So at 6 months later, it will be slightly less than it was, but it's still at a higher level than from baseline. Okay, so it can sustain the tightness for 12 months, and some women may want to have a second session, but otherwise it can go on until they feel loose again. So this is a really great study to show the proof that radio frequency can really help. So again, I always say collagen isn't just for your face anymore, it's also for your vagina, or our Miss V, like we all call it. Okay, now what about surgery? Some people ask me about surgery, vaginal tightening surgery. Yes, you can do that. And there's a lot of hospitals that's offering tightening surgery immediately after your delivery, although many don't recommend it because your vagina and your uterus is still, the vagina wall is still engorged and quite loose. So you can, it's called vaginoplasty. It's a surgical technique for vaginal tightening. We modify the vaginal diameter and surgically remove the extra vaginal tissue. And this helps to shorten or shape the vaginal muscles and tissue, but it is far more invasive. It carries its own risk. You have to stay in bed for a while. There's more downtime. So compared to vaginal lasers and radio frequency technology, it is much more risky. But sometimes if you have reached a stage where there's prolapse and there is, it's too loose, you may need the surgery. Okay, we have also, apart from fillers, we also can enhance the fullness by injecting fat tissue, or we call it fat transplantation. That is also quite a popular request now, which I do. Okay, what about uterine prolapse, where that's only surgery if it's already at the stage 3 or 4? But I must tell you, I had one patient last time from Singapore who was a lady who's a teacher, and she was having prolapse stage 3 to 4. She was actually being advised to do surgery because she really, you know, well, she has to stand a lot as a lecturer, and every 10 minutes or 15 minutes she rushes out to go to the toilet because of her prolapse. She has this incontinence. So she was advised by 3 gynecologists to do surgery, but she's not keen on the surgery because of the downtime. So she somehow saw my blog and read about the availability of Incontilase and Intimilase, contacted me, came down to KL, and we did the laser treatment. and the VVIV. After the first treatment, she said there was no difference, but after the second, she was less, and after the third, she was so happy. She called back and said that, you know, she can stand a full 1 hour without having to rush to the toilet, and then she doesn't feel her uterus, because when she puts her finger in, she can feel the uterus descending down her vagina. Now she doesn't feel it as much. So she's just doing maintenance every year now, right? So uterine prolapse, don't wait too long. If you do have it, come and go see your gynae, find out if you have it. If you have it in the early stage, you can do something about it before it gets worse, and then you will need surgery. Okay. What's the benefits of vaginal rejuvenation apart from improved appearance? Well, it will look nicer because we can cut excess skin, we can tighten skin, we can or just make it look much better, and this will give you a lot of confidence. So for many of us, even though this is not an area that is seen, it is important for our self-esteem. Okay, we should not feel embarrassed about our private parts. Of course, even more important, if you are in a regular sexual regular relationship, then it is also important for our sex life, because if you're not confident and your self-esteem is affected, then your sexual performance is going to be affected. Not to mention the sensitivity that you feel. Now, the beauty about VVIV is when you're tightening the vagina, somehow or other the sexual sensitivity also improves. So that is very important, because it's important for our relationship, right? And the more sex we have, actually, the longer we live. So that's important. The benefits of having laser and radiofrequency, of course, much outweighs surgery if you do not need surgery, if you're still in its before its late stages. It is always an outpatient procedure. They're pretty safe, they're effective. Results are almost immediate. The longest it takes is 30 days. It's considered minimally invasive. Everything is single use, and of course it's clinically proven, so you don't have to worry about the results. I've shown you the data. Okay? Well, that's all for now. We do this because we want to feel the freedom from urinary incontinence, enjoy greater sexual sensation, and we want to feel good again. Yeah? So I hope that sharing has been good for you all, and you've learned something today. We will try and you can check out the other talks, webinars that we've had on vaginal conditions like urinary incontinence and the vaginal atrophy. Go to our YouTube page, and we can then and hope to see you all again in our next webinar, which would be in 2 weeks' time. We'll talk a bit more on maybe injectables to the vulvo-vagina area to make it nicer. Okay? Any questions, anyone, before we sign off? Someone?
I have sent my questions to your chat. General questions.
Yes, chat. Hang on. I can't find my chat.
Maybe I'll just say here, can we still do if I have IUCD inserted by my gynae?
Not, it can, but for the laser, it is better that you can. It just will bother your part of the IUD string that's coming out. It might bother your IUD. So if you have your IUD and it's still in the middle of your period, your duration, right? You're not taking it out yet. You just have to tell me, because what I will have to do is I'll have to make sure that I push aside the jutting out string so that the laser probe doesn't hit it. Do you know what I mean?
Yes. So in this case, if the IUD is going to due soon, it would be better to do the treatment, then only go back for the IUD. Am I right?
Yeah. But that is the laser, because for the laser, as you can see, it goes in right in your vagina. So another way I do is I actually, let me show you. Am I sharing the screen? Can you see the screen?
Yes, can.
So it goes right in. So another way, what I do is I a gauze right here, and to cover the IUD, the jutting out IUD string, so the laser doesn't touch it at all. And then we take out the gauze. Okay. With regards to VVIF, if you're afraid that, you know, there's so much hassle and all that, so another way is we could do just VVIF. VVIF doesn't go in all the way, and some patients like this because it's only in the outer 1/3.
Okay.
And like this because it's more comfortable. It doesn't go in all the way.
But is this an option whether the customer wants to, the patient wants to take laser or VVIF, or it depends on your consultation?
VVIF is meant for tightening. Remember the muscles are here?
Yeah.
So it is working exactly where the muscles are. But some of the women, because they come a bit later in age, so they have other symptoms like vaginal wall thinning. They have laxity here, right? They feel the laxity, they have a bit of prolapse. So I would recommend, I actually do both. I do both laser that goes in all the way here, and then I do the tightening out here. Okay. There are women who don't like the feeling, they don't have much problem, but they want to maintain their tightness and the collagen here, right? Because the worst part that gets affected after childbirth is this part.
So in that case, VVIF will be more suitable for prevention.
Yes, yes. You see, if you look at what happens in childbirth, right? The head hits the outlet part. The last 2/3, the last 1/3 and 1/3 of our vagina is the one that gets affected the most. So it's actually the weakest part of the vaginal wall, number one, okay? Because it's the most hit. Number two, when we have intercourse and you and there's contraction, I showed you the anatomy. The muscles is at the end part, right? There's no muscle throughout the length of the vaginal wall. So in actual fact, when you're having intercourse, there's contraction of the vagina against the penis that gives you a lot of sensation. Gives you a sensation, gives the man, your partner, a sensation as well. It's coming from the wall, from the two muscles at the end. That's why Kegel exercise is to contract this muscle.
Yes.
Right? So VVIF's aim is to increase the collagen at that area, that part. That's their idea.
So can I conclude that if you have an IUD, also you still can do, otherwise you can come and do the treatment, then only go and insert the IUD first?
Okay, yeah. So I think when it comes, if you are keen on, it's just two different options, you know. We can combine to get the best of both worlds, so you can do one or the other. Depends on condition, depends on budget, depends on what comfort level you feel. I've had one young lady who came for the laser because it was, to be honest, it's cheaper than VVIF. But she didn't like it, so she went for VVIF. She said she didn't like the, you know, the whole thing going in, and she felt uncomfortable. She said it was hot, you know what I mean. So she prefers VVIF, and she says it's more comfortable. They slip through usually. So if you notice, you see the treatment is out here. It's here.
Oh, can I come for laser? You may have to do a few times, but for VVIF, you actually do one-time treatment,
Yes.
and it will last for 12 months tightness. Can
12
I?
to 18 months, yes.
Okay, but laser you may have to do a few times until
Laser
you find.
is 3 times recommended because each time you do the laser, it's 15 to 20% regeneration of collagen.
A few times, okay.
3 times, the
3
maximum.
times. So in terms of cost, doctor, which is more cheaper?
Actually, when you calculate the laser 3 times, it becomes the same as VVIF.
Oh.
So again, you know, some women, they don't actually have laxity, but they've delivered. The ideal, this is ideal for women who's delivered at least 2 children and age 30 and above. VVIF's target market is 2 children, 30 and above. Now, some women, they have delivered 1, and they understand that laxity can occur. Their partner is very particular and they want some form of maintenance. So I can, but they don't want anything that's major. So I'll do VVIF because it does help with the sexual sensation as well, right? Some of them a bit towards menopause, maybe they feel dry, they feel, then I will, and they feel thin out, then I will say the laser must be there.
Noted. So doctor, this VVIP, is this a day treatment that they can do and then it takes just a while and then they can go back to the normal?
Yeah, you do, and then you go home 3 days, no sexual intercourse.
Okay, any side effects that?
For Viviv, not really. You can, if I'm not careful, I can, because it's heat, right? So, but it's got a lot of safety. You know, it's like like your car has got the top end of the car has got all the ABS like this, like to prevent things. So if there's overheating, too much heat, there's a cryogen that stops. The machine stops automatically if I'm not touching. He has to completely touch the surface in order to shoot the RF shots. Otherwise, it doesn't shoot. So a lot of safety things going on there because again, you know, it's an American machine. So, and for the laser, if your vagina is thin out, you could get a little bit, because it goes in all the way, you could get a bit of bleeding. You could get spotting. You could get some discomfort inside, feel a bit sore. And you could get a vaginal thrush infection, which automatically, usually after a laser treatment, I routinely insist on you putting in some antifungal tablet and taking some antifungal drug medication.
Understand. That's all for me. But doctor, the last question is, I'm going to remove my IUD for the 5th year this year. Yeah. So after that, I just want to be clear that should I do the treatment first, then only go back to insert the IUD? Anyway, they have to remove and put in again, right?
Yeah.
So would you recommend me to remove the old one, put in a new one?
No, I would recommend to do it before you remove, because I rather if the laser were to shoot on your IUD, actually the laser is the wavelength is very specific. It's for mucous membrane.
No, so doctor, VVIP that I'm thinking of.
Or the VVIP, then it doesn't matter. But since you're going to remove the IUD and we're going to insert something, might as well you do before you insert your new one lah.
Remove and then come and do the treatment and then go back and insert.
Do the treatment, then remove and put in the new.
Or do the treatment first, then only go and remove and put in a new one. Okay, thank you.
Because then we don't confuse ourselves with the new. If you feel anything, is it the new IUD displacing? Is it moving? Is it whatever? And then, but I did my VVIP, so maybe it was the VVIP. You know, you get confused. You're thinking. Whereas now you're going to take it out. So take it out, then put new one. Then you just think about that one.
Okay, thank you, doctor. That's all from me.
Thank you. Bye. Thank you, June. Okay, and no other questions, I think. I will sign off for now. Thank you.
Thank you.